Have you ever been gaslit by a doctor, or do you wonder if they are gaslighting you? In this video I'll talk about what medical gaslighting is and who it happens to, why it happens, some examples, and some things you can do about it if it happens to you or someone you care about. The most glaring example is if they flat out tell you something is all in your head. They ignore you, don't listen, or act like you're lying. Gaslighting in general makes you doubt your sanity. I read somewhere that most medical gaslighting targets the same characteristics as most mistreatment: female, minority, children. Since some cases are intentional or subconscious, I find that believable. Why do they do it? It's complicated, and I don't think there's any one reason why healthcare professionals gaslight patients, but several possibilities. There are cases where it's intentional and not intentional. I think most of us at some point have done something out of character just given a certain set of circumstances. So if your provider has been good to you until then, maybe give them another chance. Some possible reasons include: because they don't know the answer. They don't want to say that they don't know why this could happen. It's uncomfortable and frustrating to not have a good answer, so they kind of try to make it disappear. Doctors are people too. They can just be having a bad day. They have issues in their personal lives, trouble communicating, unhealthy habits, and even personality disorders. If the doctor has some narcissistic traits, they will likely gaslight patients from time to time. Deep-seated personal beliefs and misguidance. They may believe or have been taught something that's not exactly true, or much more complex than they realize. We all start learning and developing biases, and absorbing the ideas of our families at a young age before we understand what's happening. College can help suss those out but can't force a person to examine themselves honestly, or more importantly, make them care, or want to change. Science and medicine is always changing. Medical school may have failed them in this area. Or the discussion has changed and they are not informed. Then sometimes, unfortunately, there's the completely intentional. There's the possibility that they think you could be a hypochondriac or there's something misleading in your chart. Maybe they've communicated with someone who is influencing them. Finally, they've done something wrong, and are trying to avoid consequences. There are less obvious ways to be gaslit too. They may make assumptions or jump to conclusions. You leave worse than when you went in because now you've wasted time and money, been mistreated, and probably feel hopeless. Some examples of gaslighting. You file a formal complaint about them. You are informed that they responded to the complaint that none of what you said happened. Weight is a common subject for gaslighting. Women are often dealing with doctors who pretend weight is causing all the symptoms instead of possibly being a symptom. If you just counted calories or ate more sensibly, you'd be skinny, right? Why is the doctor fat? Example: you tell your doctor you have been dieting and steadily gaining weight. They may say that you are eating more than that, or just nod their heads while you talk, and at the end of the appointment they tell you to eat better and come back in 2 months. Thanks, Dr. Gordo. That's great, now I'm fat and crazy. You say you're so frustrated and feel like you're going to die. They say you need emergency psychiatric help because you're suicidal. You have all the symptoms of a specific problem, but the very basic tests they ordered came back within the acceptable levels. They tell you it's not that and plan a follow-up and retest in 6 months or a year. Wait. They didn't help you. A procedure fails and they say it's your fault. They keep sending you to physical therapy when it's obviously not changing anything. What can you do about it? Let's be honest, there are some issues that just about everyone on the face of the earth understands and can think of a valid response or follow-up questions for. If a patient complains about something like intense digestive problems for months, the doctor knows how that would affect their own life and what can be done. If they are not addressing it, it's probably deeper than not understanding. If that's a regular thing with this doctor, you may need to find another. There's some things you can try, but as in any relationship, you can't force anyone to believe you, care about you, or respect you. Do not let it get to you. Take someone trustworthy with you to the appointment. It's easier to mistreat someone when they are alone and nice to have a second pair of ears. Try to be prepared for appointments with notes, questions, and expectations. Before they can leave the room without helping you, ask if you could see a specialist. If they have an attitude about it, try to keep your composure, because you'll get further being nice. Try something like, "I know you've done everything you can and I appreciate that." Or sometimes someone who specializes in one area has more tests they can run. If you left without saying much, understandable when you are angry, consider signing into the portal if they have one. Calmly craft an email and tell them you're frustrated and it's really bothering you. Ask for a referral or medicine. Please remember to subscribe and let us know what else you think people should know in the comments. Join our knee dislocation group on Facebook or search for a group that can understand what you're going through. Take care and remember you are not alone.